Today we have with us Emma Raffray, Chief Research and Analysis Officer at the CyberPeace Institute, here to present some insightful data from the cyber incident tracer she's developed, which showcases how cyber attacks disrupt the delivery of healthcare and compromise sensitive healthcare-related data. Emma, over to you.
Thanks, Abhinav. It's a pleasure to be here. Since mid-2020, the CyberPeace Institute has tracked over 500 disruptive cyber attacks and their impact on healthcare organizations in over 40 countries. Peaking during the pandemic in October 2021, the threat to hospitals, medical specialists, national health systems, and other healthcare institutions and companies remains very real today. We've documented attacks on healthcare organizations across all regions of the world. The United States sees the greatest proportion of attacks, but saw a relative decrease of about 40% of attacks in the first part of 2022. Whilst in other regions of the world, the numbers have remained similar to 2021. When a disruptive attack occurs against a healthcare organization, it takes an average of 19 days for operational activities to return to normal. This can impact the provision of medical care, access to medical records, disrupt the pharmaceutical supply chains, and delay urgent medical assistance. An average of 160,000 records are breached in a single disruptive cyber attack. When sensitive patient data is exposed and exfiltrated, it often ends up leaked or made available for sale on the darknet. We've identified over 50 threat actors targeting the sector. They often operate under a ransomware-as-a-service business model, enabling affiliates to use already developed ransomware tools to execute attacks. These groups are highly dynamic, regularly rebranding themselves, further complexifying the attribution and accountability process. Healthcare is a critical infrastructure sector and must be protected from cyber attacks. Disruptions to patient care endanger lives and create stress and suffering for patients and medical professionals. We must start by recognizing that cyber attacks on healthcare are attacks on people.
Thank you, Emma, for showing us that wealth of data. I'm actually curious to understand from you, how did you go about collecting all of that data, and what are some of the challenges that you faced while doing so?
Yeah, thanks, Abhinav. So the majority of the data that we're collecting is coming from publicly available data sources, and we're heavily reliant on media reporting related to attacks. And one of the biggest challenges that we found is the significant underreporting of attacks across all countries in the world. And therefore, we're dependent on such things as media reports to be able to actually identify the scale and the nature of cyber attacks against sectors such as the healthcare sector.
Thank you very much.